Southwestern Vermont Healthcare is a hospital, nursing home, home health agency. We're taking care of our families, friends, or neighbors. We know the people in our patient beds, and it wasn't okay to excuse it when it was a medical error. In most cases, about 90% of the time, they're caused by broken down systems or processes. We don't want that to be true here. And so we committed to change our processes, change our systems. We have a 150-bed nursing home in addition to our 100-bed hospital. And in our nursing home, we have 100 long-term care residents. One of the things that we were recognizing is that we had some of the highest percentages of skin ulcer rates. When we implemented a Lean Six Sigma project, our surprise was, and the aha was, it wasn't even occurring at the nursing home. It was actually occurring at the hospital. In fact, in many cases, it was occurring before the patient was even admitted. These things cost anywhere from $3,000 to $30,000 or $40,000 per patient to treat once you have it. And they could kill a patient, and they can kill a resident. We needed to change that reality, and we did. The main problem was in a hospital, we were using the best mattresses around, but they weren't the kind designed to prevent wound ulcers. And by changing every mattress in the hospital and changing every mattress in the nursing home, our skin ulcer rate went right back down through the floor. And now we're beating national averages, state averages, and everything else in the results. It's saving us almost $200,000 a year. In a lot of hospitals, Medicare consistently changes its rules in order to mitigate the amount they're paying. They were no longer going to pay for patients admitted to the hospital that were there for observation. Unfortunately, if you leave a patient too long as an observation case and then take care of them and don't move them when they should be moved into being classified as an inpatient admission, you can lose a great deal of money from Medicare. Well, we were losing about $600,000 or $700,000 a year just from that process alone. By reducing the number of observation cases, we've got almost $1 million better bottom line than we projected this year. Many of our patients were dying in the hospital. We didn't match national averages in terms of the number of patients that were referred into hospice, where they can die at home with their families around them and with a lot more dignity than they might die in a hospital setting. When we drilled down through the Sigma studies, we realized patients were choosing to stay here because they didn't know about hospice soon enough. Secondly, trying to control pain and pain management. We identified all the things that we needed to do to get the palliation, the pain management process occurring very early in the patient's stay, and getting them on a regimen that could be copied, duplicated in the home care environment, where the home care employee actually started with the patient and then transitioned the patient so there was a connection to them as an outpatient. The net result of all of this is we've got now an increasing number of people that are going home to be a part of the hospice process. And from a hospital's perspective, where a patient has stopped paying after the initial 30 days or an insurance company has stopped paying after the initial DRG payment, we could lose almost $30,000 or $40,000 on a case.
Benefits are in the results. The communication with physicians is around data. It's the kind of thing that doctors are more used to having a conversation about. A run chart, data points, here's where we are, here's where we want to be. And that has really helped physicians understand that change can really happen and that people in our organization can bring a science of change to their clinical processes. The big one we're working on right now is a breast cancer project, and it was very helpful to doctors to have data about how we're performing right now on identifying breast cancer. We're looking at the timing between when a woman first hears about an abnormal mammogram and eventually gets a result. And we are able to show our performance, gather data, present that to physicians, and engage them in setting a goal for improving that time interval for our patients, and then showing improvement in that.
This is not just about money. It's about quality. It's about safer care. It's about the direction that we need to go in healthcare if we're going to have a positive impact on mitigating the growth in insurance premiums. So this is about our vision. And Lean Six Sigma and Juran Institute has done a great deal to help move us a lot of forward steps toward that vision. And we're grateful for it.